Hello.
So good evening, everyone. A warm welcome to all our viewers. I'm Dr. Sejal Naik, Chairperson Endoscopy Committee FOGSI. Welcomes you here for the Gyaan Pravah. As we all know, this is the space where we all bring the stories, struggles, brilliance, and breakthrough from the stalwarts in our field. Introducing today Dr. Sunita Tandulwadkar ma'am. As we all know, before we begin, it is my privilege and pride for this conversation. A leader whose presence elevates every platform she steps on. A visionary who has shaped the direction of gynecological endoscopy in India, and a mentor whose wisdom has guided generations of surgeons, including me. Dr. Sunita Tandulwadkar is not just a senior figure in our fraternity, she is an institution, a force of knowledge, discipline, and innovation. A woman whose journey is testament of courage, clarity of purpose, and relentless pursuit of excellence. Her contribution in endoscopy also and mentoring shape, training, and development of young talent have created a legacy that titles the achievement that we all achieve through her guidance. To many of us, she is a compass that keeps our professional journey and even a personal journey up to some level alleged with the integrity, skill, and compassion. So it's an honor to have you, madam, always. And
Thank you, Sejal. I did not stop you for obvious reason, which you and me know. But it's always love to, you have, today I started my day with the cesareans. They were very difficult cesarean, adenomyosis operated, then IVF conceived, and the other was 106 kg twins, my tennis elbow, and then one patient whom we induced last night, normal delivery, vacuum. I was exhausted. And but it was so beautiful to listen to what you were saying. I don't know whether it's a true or false, or it is exaggerated, but कानों को अच्छा लग रहा था.
ma'am, being if it is
I
a
was
obstetrics or gynecology, whether it is infertility or rejuvenation or regenerative medicines or whatever the advancement, robotics and everything, all the plethora is there under your umbrella, madam. So it is one has to be
you know
really very
what?
lucky to work under you, madam.
I know. And yeah, day before yesterday, I got a photograph where you, Pooja, everyone, where that year was a golden year of my practice and your education. I think 2011, Sejal, the time flies. Now 15 years, you have your own students under you. And I'm so proud of you, Sejal. When I see you with your student working, teaching them, I said, look at this. Well, we created not only the great endoscopic surgeon, but the leader who is creating many more leaders. So that is wonderful. Now, coming to sometimes what happens, I usually don't allow the chairperson to keep on introducing me because there's no point in wasting time over with us. But what is important is today I was damn exhausted, Sejal, and little disappointed because tomorrow was our Arogya Yog Yatra to Ayodhya. And we all were so geared up to travel to Ayodhya and Indigo flights. I spoke with the higher authority. They said बॉम्बे से अयोध्या जा रहे हो तो आपकी फ्लाइट कैंसिल नहीं होगी बट वापस रिटर्न अगर पुणे आना चाहते हो लखनऊ से तो it is a smaller sector Lucknow. We don't know whether we'll be taking you back. And forget only me, there were many people from Indore and from Trichy uh, traveling. So we need to, reschedule Ayodhya. Now, because of Manish Pandya, we have rescheduled Dwarka. We are running so tight. We don't know when we are going to schedule it again. And now usme Ayodhya aaya. So I was little disappointed with Ayodhya. But then It was beautiful to listen to you elevated my mood and I enjoyed. I don't know whether I deserve. And most of the time what happens is uh, sometimes you need to rethink, ki, is this all true what you are saying? Am
No,
I
ma'am.
really aged?
Absolutely. We feel that even the ChatGPT is short of words sometimes, that we cannot
Hi,
express
Hafiz.
our feelings in words, ma'am.
Hi, Hafiz.
Hi,
Hi,
Sejal,
wonderful.
I'm so sorry.
So that's okay.
Now this
We
is
are live.
a podcast which starts really by 8 o'clock, and it is so lovely, Hafiz. I join every day 8 p.m. just to show my respect to the faculty who is giving their time to FOGSI, and thank you so much for coming on a FOGSI platform. On IAG, you are always there, but the FOGSI is bigger, and it will be so great to have this podcast. And Sejal, I request you give the link to Hafiz so that he can circulate among his hundreds and thousands of fellows. Hafiz, thank you so
Yes.
much. It's lovely to see you. I know you are a workaholic. You were still late in the operation theater, but now I won't take much time. Sejal, we are already 5 minutes, so enjoy your journey. Hafiz, I joined from the viewers link, and only you and Sejal will be in the dialogue, and I
Yeah.
will enjoy the conversation from other link. Thank you.
Okay, fine.
Thank
Yeah.
you so
Thank you.
much, ma'am. Thank you.
Thank you.
So today we are also joined by a towering name in the world of minimally invasive gynecological surgery, a surgeon whose skill has influenced practice across India and abroad, the founder and guiding force behind the Sunrise Group of Hospitals, and a pioneer who introduced advanced gynec endoscopy in regions where it barely existed. Dr. Hafeez Rahman. Dr. Hafeez Rahman is celebrated for his groundbreaking surgical volume, his innovations, his teaching, and his global impact. But while the world knows the luminary, very few knows the journey, the challenges, decisions, philosophies, and defining moments that crafted the legend. And that is exactly why this podcast exists today, to uncover the stories behind the success, the human behind surgeon, and the journey behind the inspiration. It is my privilege to welcome you here, sir. With your busy schedule and the lots of responsibility, you could make it on time. Thank you so much and welcome to the FOGSI Gyaan Pravah, a FOGSI Presidential Initiative, a live podcast, sir.
Thank you, Sejal, and thank you, Foxy.
So, sir, without wasting much more time, we are very eager and desperate to listen from you that you have performed over more than 100,000 endoscopic surgeries and built like Sunrise into a global institution. So, what were the defining moments that shape your journey from your young clinician to this surgical legend?
Sejal, I think I'll just start little before the young clinician stage.
Okay.
That is when I was doing my postgraduate studies in Ahmedabad. I come from Cochin, Kerala, down south of India, and I had gone to Ahmedabad for my postgraduate studies.
BJ
Now
Medical.
in Ahmedabad, yeah, in Ahmedabad, one of my best luck was I was in BJ Medical College, which is attached to MP Shah Cancer Hospital.
Okay.
Now, what happened when I was doing a post graduation in Ahmedabad is that when in MP Shah Cancer Hospital, there were two surgeons who came to give training in oncosurgery, in gynae oncosurgery. So that time, what happened? Dr. Neville Hecker and Monahan from UK and Neville Hecker from Australia. So they were doing there used to be a lot of surgeries in since it's a cancer institute. So they were doing surgeries from morning to evening or night. And I had a rare chance to wash with them for all the surgeries as a student in MP Shah Cancer Hospital.
Wow.
So this has actually given me a very good exposure in oncosurgery. And with that exposure from Ahmedabad, I came to Cochin and started my practice in Cochin. Actually, that time there were so many gynecologists in Cochin, and no hospital was ready to give me a job in Cochin. So I went to one hospital, which is the director of the hospital was my friend, and he told me that he will not give a job, but he will give me an OPD where I can sit and see patients, whichever patients which comes to me. So I agreed to it, and I sat in that OPD for almost 1 month. Not a single patient came to me. 1 month, 1 month I was in the OPD and sitting and reading, and not a single patient came to me, basically because there were 5 roaring practitioners, gynecologists who were sitting next to me, also may not come to me. So that 1 month passed away like that. Then one of the practitioner, one of the gastroenterologists, who was a very famous gastroenterologist throughout India, known as Dr. Philip Augustine, he referred a case of fibroid to me. That was my first OPD and my first case. And I didn't waste any time. I did a hysterectomy, an open hysterectomy for that patient. So that was my first surgery, an open surgery. Then I understood that this is not going to work out. So what happened is I told the other 5 gynecologists that I know laparoscopy surgery.
Sir, your voice. So there is some transmission issue in your voice. Sir, we can't hear you. Your voice is like broken in between. Support team. Hello.
Yes, ma'am.
Can you hear the sir's voice clearly?
No. Actually, the network issue is there. He's
Sir,
traveling, that's why.
on your side, the network issue is there.
Sir has disconnected.
Oh, okay. We'll wait for a few minutes. Yeah. Yes, sir, you are mute. Sir, you are mute.
Now?
Yes, sir. Yes, sir.
Okay.
So after that first fibroid,
So is it clear?
yes, sir, better.
Okay. Now, see, after that first case, then I told the gynecologist, the five of them, I told them that I knew laparoscopy. Actually, it was not laparoscopy. I had the training in lab sterilization. So what happened is one of the gynecologists, they posted a case for laparoscopic surgery, and that was endometriosis. And that was my first lab surgery case in my lifetime. That was the first lab surgery case, endometriotic cystectomy, not a bad endometriosis, but somehow with my training in laparoscopic sterilization and my background in laparoscopic oncosurgeries, I could actually finish this case. That was the biggest advantage I had, or the biggest victory I had in my life. The first laparoscopic case being endometriosis, and I could finish it laparoscopically. Then I understood that this is not going to work out because I'm not starting to get cases. So I bought a small laparoscopy set, no camera. It was just a telescope because I didn't have that much money at that time to buy camera and all those things. So I didn't have much of income. So it was just a telescope, insufflator, and few instruments. And I started going around in hospitals in Cochin. That is for minor laparoscopic surgery. We used to do laparoscopy looking straight through the scope, and that is how we started laparoscopic surgery. Then I started going outside Cochin. Those days even carbon dioxide was not very standardized. We used to use this soda gas carbon dioxide, and actually I trained one of the factories to make the medical grade carbon dioxide. And in many places where I used to go, there used to be no carbon dioxide, and we had to carry the cylinder even to go and do laparoscopic surgery because there was no carbon dioxide. And we used to travel by trains also, not even by car, sometimes by train also, carrying the cylinder. That small cylinder of carbon dioxide used to be there, and we used to carry that. So with that, I started laparoscopy, and then the first conference I ever attended for laparoscopy was in Hyderabad. That's outside, first conference outside Kerala. Dr. Rajan was my mentor, my greatest support during those days. I don't know how many of you know Dr. Rajan. He was a legend in all over the country. And my first conference was in Hyderabad, where I met Dr. Das Gupta and Dr. DK Tang. These are the two people later on, they helped me a lot in my life and they brought me up. So with laparoscopy, what actually happened is I started traveling all over the country. Those days I used to go from here to Bombay, Thane, then I used to go to Dhanu, I used to go to Delhi, then Agra, then I used to come to Calcutta, then I used to cover the entire northeast. We used to go to Guwahati, then Silchar, Pasigat, so many places I used to go travel and do surgeries. And then I come back to Tamil Nadu. In Tamil Nadu, I used to go to Salem, Erode, Coimbatore, and then come back home. It was something like an all India tour I used to make doing laparoscopy. And the number of laparoscopies I used to handle those days, even at
I think we lost him again. Oh, it is so interesting story, no? But still. Sir has joined.
Yeah, Sejal, can you hear me?
Yes, sir. Yes, sir.
Yeah. So we used to operate from morning 6 o'clock to night 2 o'clock, and the next day morning again 6 o'clock we used to start, and we operate till 12 o'clock because 2 o'clock was my flight from Silchar. That was an army airport. That was the only flight. Otherwise, I'll have to leave 2 days later only. So
Mm.
this was the kind of work we used to do. And today, if people ask me, and when I tell that I've done more than 1,50,000 surgeries, people used to calculate the number of years and they used to think that I'm bluffing. Same thing happened when I once went to Oman for the interview board. So that time I had a logbook of 1 lakh surgeries and they thought that I am just bluffing. Luckily, two of the gynecologists there in the board were my patients. I had operated on them. So that's how, I could convince them, okay, this type of surgeries were done. So this was the numbers we used to handle even in places like Erode, where Dr. Dhanabhagyam is there. She used to post a huge number of cases, and one day I had operated more than 42 surgeries. These are all not sterilization. These are basically laparoscopic surgeries. So this kind of workload which I could do has actually increased the skill a lot. Basically, see, I was an artist. I used to do a lot of paintings and all. So when I came into laparoscopy and when the screen me, I really felt like it was like doing a painting for me in laparoscopy. And I was a born ambidextrous. And being an ambidextrous, I understood that time that I could do laparoscopy very well because these are the two best qualities which anybody can have. That is, one is being an ambidextrous and being an artist, looking at the screen and doing something like a painting. So I could exhibit my skill laparoscopy and the large numbers which I got. The large, see, even today I had done I think around 15 surgeries. I am sitting here. So this is the kind of volume we used to handle, and this volume has actually brought out the skill in me. And what has actually happened is today pelvis is like, it's a very familiar area for me, and I could see and I could understand each and every tissue and fascia. So that is how we bought in the concept of tissue surgeries. Most of the surgeons, they are position surgeons. They understand that this is the uterus when they see some globular thing in the uterus. But after doing so many surgeries, I started understanding each and every tissue, looking at it. And I could see that the planes will just give way to my entry into that planes very easily because I knew the each and every tissue in that plane. I knew each and every structure by the texture and look of it. So I could easily walk into any place in the pelvis. So that has given me a lot of advantage in my journey through laparoscopy. So basically, to the youngsters, I used to always say that you have to do numbers. You cannot learn laparoscopy doing just some cases or one case in a day or two cases in a day. You cannot be very skilled in laparoscopy. You have to do a lot of numbers every day. That is the only way to come into laparoscopy.
So, sir, it's it's a really amazing to your all India travel and the various um, various places where you may not have the all the facilities, everything in as per your standards, and you have to adapt with this situation. So, what are the driving forces that you keep that make you keep going, and doing so much, so many numbers? Because uh, doesn't like your as you said, today's era or the Gen Z are 9 to 5 workers. They do not believe in doing any overwork, or they just want to work only till they have good enough of pocket money. That's all. So, what was your driving force to such a hard work?
See, there are two ways of looking at life and work. See, you can work to earn a living. That is one way of looking at it. But you can work to enjoy your life. So if you are in a profession which you enjoy, so I used to enjoy doing laparoscopy even today. Even today, every challenging case I used to enjoy, and I used to enjoy and work. And that has I never worked for earning a living, even though I was not rich and I was quite poor actually. And but I never worked to earn a living. I told you, no, I didn't have a salary initially. So I never worked to earn a living. Money was a byproduct for me. So I enjoyed my work and I did my work, and that made me work so much because I used to even think, say, somebody has to see like Erode and all. I used to work from morning 6 o'clock to night. So working like that and doing so many cases, nobody can just do so many cases if he or she is working to live a life. So it's basically my enjoyment, and including Sundays we operate. So I used to operate even Sundays also. So people used to ask me, why are you so crazy? Is it that you want to make more money? It's not that I want to make more money. Sundays, otherwise you play football, which is enjoyment. For me, doing laparoscopy is much more enjoyment than working on doing playing football and doing any other thing.
So
So basically the driving force is what I am doing is what I enjoy actually.
passion.
It's a passion basically.
So, sir, where is the life work balance? Your take on life work balance?
So basically, see, what is actually life work balance? Basically, you have to enjoy your life. So if I am enjoying my work, then I am enjoying my entire life. Then the question comes with your family and children. So usually people used to ask my children whether you miss Papa. The problem is many of us, what happens is you have a fixed day of work, fixed time of work, then you go home, you will be on paper and you will be on some other thing, or you go to the club. I never used to go to club or anything. Whenever I am off my work, I am with my family. So basically, it's the quality time which you give to family, which is much more important. And today, none of my children, they say that they miss me and I was working too hard. They didn't get me enough of me.
Hmm.
So it's basically the quality time you give to them, and then you also enjoy. And my wife used to come to me in many of my tours on many, whenever, most of the time when I used to go abroad and all. So after doing surgeries in India, actually, I started going abroad. I started going to many places, including Pakistan. I was one of the first person to do laparoscopic surgery in Pakistan and Bangladesh. So we used to go, I used to go almost regularly and do surgeries there. Sri Lanka, we did a lot of workshops and things like that. Then I started going to Gulf. Actually, Gulf, Dubai, one of my trainees took me to one hospital in Sharjah, and that is how I started doing surgeries there. So Dubai, actually, that time there was not many people doing laparoscopic surgery in Gulf. Dubai, not only Dubai, in the entire Gulf. So I picked up quite fast doing laparoscopic surgeries there. And that time I was like doing almost 10, 15 days in Dubai, and then the rest of the time in India. So in the Gulf, I started traveling in the entire Gulf region, in many of the hospitals in the entire Gulf region. And there were times when I used to operate in 3 different countries in one day. Like I used to do surgeries in Dubai, 3, 4 surgeries. Then I used to fly to Bahrain, do surgeries in Bahrain. And then I used to come down to Muscat, then do some surgeries in Muscat, and then reach my home in Dubai. So this was the time when I used to
My
enjoy.
lunch in Bahrain and dinner at in India like that.
Yeah, something like that. You may call it as lunch, but I will call it as uterus in Dubai, then fibroid in Bahrain, and ovarian cyst in Muscat. so, so that was a time when I used to really enjoy traveling. And when we travel also, we are not traveling as tourists, we are traveling for work. So then I used to go to the places and visit people also, so understand their culture and things like that. And then that was actually really enjoyment, seeing many cultures and seeing different setups. Every day you are in actually a different OT and different setup, which I
Hmm.
really used to enjoy. Then I started going to Africa.
Hmm.
So many places in Africa I used to operate, and I used to go regularly to Nigeria. Going to Nigeria was actually a big experience for me, and that is the place where I actually learned to do myomectomy.
Oh.
So we used to go as a team. Dr. Nikita used to come. Dr. Anil Makhdoom used to come. So many people used to come with me to do surgeries, and that is a place where actually I learned to do fibroids, and fibroids were so much in Nigeria. So again, that is another place where we used to operate till morning to evening. Continuously, I used to go stay there for almost 5 days, continuously operating, and huge number of fibroids we used to operate in those places and many other places in Africa also. So that actually this kind of travel and this kind of doing surgeries has helped me a lot. And this has actually increased my exposure to different types of surgeries. And one of the biggest advantage I got in Dubai is I used to actually do surgeries in different ethnic races.
Mm.
So it's the tissue difference I used to appreciate in all these different ethnic races. I used to do surgeries for an Arab patient, an Indian patient. Then I used to get references from European countries to Dubai. So it will be a Caucasian patient, then Chinese patient. So today, operating on all these patients, we understand that the collagen is different in each of the patient. It's actually uterus and ovary is fine, but even the skin, uterus, tissue, fascia, ovaries, everything is different in different ethnic races. So, like I used to say that the African patients, they have yellow ovaries. If I touch the vaginal mucosa, I can understand which is the race of the patient, whether it's an Indian patient or Chinese patient or an European patient. If I touch the skin, I can understand which is the race of the patient. So this differentiation in the tissues and collagen and operating in different uh, types of patients has helped me a lot again to navigate in the pelvis and do my laparoscopic surgeries a lot.
So, sir, so much of like hard work or whatever you enjoy the work, so numbers, huge numbers. So, where did you get this idea of training to give training to others, and how can you find out time to train these, new young uh, people? Like, it's difficult to manage such a heavy workload with the training academy, isn't it?
Yeah. It was not difficult actually because this is all together. It just flows together. See, I was quite interested in teaching from my younger days. Like when I used to do my MBBS, I used to have every day. I used to have my own lecture classes in the casualty where people used to attend that. And when I was doing a house surgery in Kottayam Medical College, where Professor Rajan was the professor, I used to take every day in the medicine ward. I used to take classes. So a lot of these students, even the tutors and postgraduate students, me being a house surgeon, they used to come and attend the classes. So
Mm.
training was actually my passion. And Dr. Paul was there who was doing surgery with me in the same hospital. So we starting a training together. I used to operate in the morning, daytime, and Paul used to usually operate in the night. So what happened is we started this training course together, and that was a very tough time for the trainees because I used to catch them in the daytime, take them for surgeries, and I used to travel even in Cochin also. I used to travel all the way to different hospitals. So morning around 7 o'clock, I used to take them, travel around, and leave them by 6 o'clock. Paul starts his surgeries by night 8 o'clock. you know he continues throughout the night. Sometimes he goes up to 3 o'clock, 4 o'clock and all. Then again I'll catch these fellows by 7 o'clock. So it was like continuously, throughout 24 hours they used to get an exposure of laparoscopy. But they also were interested in doing like that. So then we started training differently. So this was initially Paul and me used to train together, and then we started training differently. Paul started his own hospital, and I started Sunrise. So that's how we started training separately. And training was again a passion. And I used to understand that the trainees who come for training, see, now I think we have trained maybe much more than 5,000 doctors in laparoscopic surgery. And one thing I understood is that for laparoscopy, you need something like a laparoscopy center in the brain. You know, while training, I used to watch them. Some of the doctors, they just pick up laparoscopy just like that. Within 15 days, 1 month, they pick up laparoscopy and they are able to do it. But some of them, they just cannot do it. By hard work, they will do to some extent. By severe training and for rigorous training and hard work, they may be able to do to some extent, but not everybody is able to do it. So that is a time when I recognize that they need to have some kind of a center in their brain to do laparoscopy, and not everybody can do laparoscopy. So whichever trainee comes today, I used to tell them that you have to decide whether you have the center in you or not. If you do not have the center, don't waste your time. You can go at it IVF or obstetrics or some other thing. If you don't have the center for laparoscopy, don't get into laparoscopy, because there is nothing like everybody has to do laparoscopy. There are so many other things which people can do and excel. So basically, and another thing is, if you don't have that center in you, then you will not enjoy doing laparoscopy also. Then you will not excel. Then your life gets frustrated. Why do you want to do that? You may be having the center for IVF in your brain. So you can go for IVF. So this is the usual advice I give them. Most of the trainees, I tell this. And they, of course, they understand. Usually within 10 days, I understand whether they are good for laparoscopy or not. So this is something I used to tell my students, and training went on, and it still goes on. Still, we have a lot of students coming here and training. Actually, we never advertise for any training and all. Uh, Basically, I understood that training means give them hands-on. I don't teach much of theory in our training courses. Initially and all, we used to take classes, but now the cases are so high, we don't have time to take classes. So I ask them to read and come. I focus on practical training for the students. I used to always tell the students, this is like learning swimming. Whatever theory you learn and stand on the shore, you will not learn swimming. The moment you get into water, you will drown. So if you want to learn swimming, you get into water. Initial days, I used to train them in pumpkins. We used to have pumpkin. If you put the laparoscope into the pumpkin, it will look like full additions. So I used to make them do additionalizers. Even my children used to see them training, and they know how to use the pumpkin and all. So afterwards, I understood that these are all useless exercise until and unless they operate on live patients. They are not able, they will never be able to do laparoscopy. That is how we started this thing called hands-on training. Hands-on training is pure hands-on training, and touch wood, we didn't have much of complications because of this hands-on training protocol, because our training protocols are very standardized. Each and every technique, basically we train them first in hysterectomy. So each and every technique is so standardized, and we tell them, and they go in that standardized path, and the entire OT is trained for watching the trainees do the procedure, and our complication rates with the trainees are much lesser than my own complication rates. So when they are doing, we are much more careful. So that's how we started the training, and we go on with the training.
So, sir, from one hospital Sunrise to the Sunrise groups of hospital, your journey as a excellent surgeon to the entrepreneur.
Sunrise Hospital was actually not a business proposal for us. It was a passion. Basically, what happened is I am a completely unconventional surgeon. So when I work in a hospital, I have to follow certain rules and regulations. Like I have to do this kind of surgeries only, I have to do that kind of surgery. So I need to work in rules and regulations. So being a completely unconventional surgeon and being a little daring and out of the box. I used to always think, think myself, say, why am I thinking like this? Because I always think out of the box, think differently. 25 years or 30 years back, I used to say that cesarean time is the best time to do myomectomy. Nobody accepted me. Even I had heated discussions in many conferences, and now people are accepting all these things. Many things I had told much before, like malignancy, cervical malignancy, endometrial malignancy. When I told that it has to be done laparoscopically, nobody accepted it those days. Like that, so many things. So I used to think completely unconventional. So I need to go completely unconventional. That's how I started thinking that this is possible only with my own center. If I start my own center, so I started Sunrise. My entire capital was around 80 lakh rupees, which is the money. I am not from a very rich family, so which is the money I earned from laparoscopy. So all these things started with laparoscopy. So Sunrise was initially a 10-story building. I took 3 crore loan, but the 10-story building has only 2 floors actually done. The rest was just shell and core. So, but it looked like a big building. So in the first day of just before the opening, the first case, actually I was myself standing and cleaning the operation theaters. It was just operation theaters and some rooms which are started first. But by that time, I was around 40 years and we had a good, very good practice. Actually, I had a very good practice. So Sunrise went on very well. And initially, I started managing Sunrise myself. Me and my wife. My wife was the biggest pillar for me. So she had been throughout with me for the training, everything. She was there, and she was there in Sunrise also to manage Sunrise. And we started managing Sunrise ourselves, and we understood that we can never manage a hospital. I was a good surgeon. And my wife used to take care of the finance because she didn't want anybody to steal the money. So she used to take care of the finance. Not that she was good in finance or she was a professional in finance, because she didn't want the money to go into some other hands. So she started managing finance. So slowly we started understanding that we are not good at management. That understanding made us put in professional management team in Sunrise. So this is more important. As I used to tell my trainees also, the moment I understand that you can also do better than me, I'll be able to give you more hands-on. So my understanding that there are people who can do better surgery than me made me give proper hands-on to my trainees, and they used to do. So same way, when I understood that I am not good in management, I kept professionals and I started managing Sunrise. And that was the biggest boon of Sunrise. And that is how Sunrise started slowly coming up. Then we started hospital. We started actually in hospitals in Kerala initially. Today we have around 8 hospitals in Kerala. Then we started in Delhi with Dr. Nikita Trihan. Then I had a hospital in Dubai. I had around 9 clinics in Dubai. We had one of that time when I started in Dubai. That was the second largest hospital in Dubai as such, International Modern Hospital. Then Delhi, Bombay, we started a very good hospital. We had a lot of ups and downs in our journey in Sunrise. We had, especially during the COVID time, we had huge losses in Dubai because of insurance companies, a lot of things. And we had the entire hospital which got burnt in Bombay. But see, it was not it was not the success we used to cherish. Actually, the success depends on how we manage our difficulties. Now, the management of difficulties is actually the key to success. There are 2 things. One is understanding your capabilities and priorities and managing the difficulties properly. The moment I understood that I am not capable of managing and I put professionals into management, that is the time when I became successful. So that I could actually concentrate in laparoscopy and I could actually concentrate in what I am good at. I need not bother in what I am good at. I was good at doing business. I've always felt that I am a born entrepreneur, but I am not a manager. I will not be able to manage things, but I could understand business ideas and how to do business actually. So that made me go into multiple hospitals and we used to grow quite fast. And going to Dubai was a big eye-opener, and having Dr. Nikita also with me was a big eye-opener for me to understand what is the rest of the world and what is the rest of India. and outside Kerala, and I went to Dubai. I understood much more banking and finance. It's very important for any entrepreneur to understand international banking, finance, and all those things. And that has actually made me think a lot, and Sunrise grew into a multi-specialty hospital. So today, my brother is there in Africa also. We have hospitals in Congo. We have hospitals, actually 7 hospitals in Africa. We have 8 in Kerala itself. And today we have, I think, around more than 3,000 beds, and we have around 8,000 to 9,000 staff working with Sunrise. And it has grown into a quite a big institution. So I am not the person who grew it. We have professional people who grew it. I'm still a laparoscopic surgeon, but understanding what is entrepreneurship and just growing this thing with my idea of entrepreneurship. So I could guide the professionals who can do it. So which team of professionals with us who can help us grow all these things to this level. So basic advice with all these things is understand what you cannot do and understand what you can actually do. So concentrate on things which you can do. Leave the rest to others.
Yeah, what I feel right now, it's like a film story of your journey from a postgraduate student to the global brand, the Sunrise Group of Hospitals, sir. So thank you so much for sharing your experience. Really very inspirational, and we are thrilled to know that it's a legend, the stalwarts they born through dream, dare to dream, to inspire generations and push the boundaries. Your creativeness, your hard work, your passion, and that is much more to learn from you, sir. So it was a grateful moment for me as well to all the viewers, and we are thank you so much, even to the FOGSI, Dr. Sunita Tandulwadkar ma'am, for giving this platform so that each new brain or the aspiring gynecologist can have one foot forward towards the goal and achievement. So thank you so much.
Sejal, putting a last closing remark is,
Yes, sir.
in my journey, I used to work so hard, but one bad thing which I did is I never published my work. So that was a bad thing, and I could always see that after years of me doing the same thing, somebody comes in and publishes the same thing as first time they have done it. So this is one wrong thing, and this is advice I should give to youngsters, that even though you are quite busy in your work, you need to publish your data. Now we have started doing it. Now 2 of my daughters are there with me doing the same laparoscopic surgery. Both of them are today fantastic laparoscopic surgeons, and we have started publishing a lot. We have started. I have the entire data, but I never published things. I didn't write it down. I taught a lot of students, but now today we have started publishing. And with the entire data of all these years of more than 150,000 surgeries, I think we should have the highest data in the world today. And this, if it goes into publications, this can be one of the best publication places. So
Definitely.
this is the advice: you start publishing your data and start publishing your work at your young age itself, which is very, very important.
Wow, sir. So, sir, last one question. If you were not a laparoscopic surgeon, what would you be?
I would have been a financial person. That is the best thing
See you
which can
soon
rule
in
every
your
laparoscopic surgeon
financial.
and every management.
Yeah, see you soon, sir, in a financial advisor role. Soon, sir. Please guide us into laparoscopy and now into finance as well. Thank
Because
you.
ultimately we can see that finance is something which controls everything.
Everything correct.
But only if it is your passion, you will be able to do it.
Absolutely, sir. Thank you so much for your time and valuable insights, sir, sharing your experience. And it was absolutely new for me as well because we couldn't speak before your this today's podcast. So I was eager to know before like conversation, but it went very well and within a
Yeah,
flow.
Sejal, all these days were too busy for me and too
I
hectic
do.
because of so many other problems also.
I do. I
I'm
do.
so sorry for that.
No, no, thank you, sir. But it's okay. It's really thrilling because if I knew the the climax of the film, I would never enjoy it. So thank you, thank you, sir. Thank you once again. Thank you, Evangel
Thank you
team,
so
for
much.
your support, and we'll share the link to you, sir.
Yes.
Yeah.
Okay.
Thank you. Thank you. Good night, sir. Thank you.